We're here today at Craigavon Area Hospital and out on another 24-hour strike, which at the end of the day we don't want to be on. We'd rather be at our work, but we're looking for obviously a better pay rate. We're looking safe staffing, and we're looking the rates for the domiciliary care workers and the care workers out in the community, that they're having to use their own money to fuel their own vehicles. We're losing staff hand over fist. We can't retain staff that we have because they can go to other jobs for paying more money, and it's a serious time.
It's like any organisation, it's a chronic thing. You have chronic and you have acute, so from time to time you'll hear all the acute stuff, the pressures on ED, people not being able to get out of hospital, ambulance waits, all that sort of thing. But you know, the chronic thing is just as much of a problematic issue. People not able to get appointments, scans, elective procedures, waiting lists going up. So the health service has to respond to urgent and does its best to deal with urgent things, but we're stumbling from crisis to crisis. People say COVID was a crisis, but there was a crisis before that. Every winter there's a crisis. Now it's all year round is a crisis. Then COVID has compounded the crisis. There's going to be other crises. The reason the crises aren't natural occurring things. The crises are because the health service is trying to cope with the demand on it without the resources to appropriately meet that demand.
I feel as if you're just kicked from pillar to post, and you don't feel as if you're doing any good because there's issues all the time. ED's full all the time. If you're in ED, you can't get onto a ward because there's no beds there. The ambulances are queued up outside with patients, and it's a very, very depressing and distressing time for members of staff.
Well, I suppose the question is how much are people prepared to see the health service wither and die? Do you want to continue the way we're going forward? We have no other way really of getting our message across unless we do something like this. That's why you're here today, because we're in strike action. So the people need to be pressurising their politicians, their representatives to say, address this issue, get it sorted out, because without proper paid health service, you won't have a staff, you won't have a health service. Is that what people want? Definitely it's not what I hear people want. People want a proper health service. They want a health service that meets their demands and meets their requirements, and at the minute the health service is struggling to do that.
I mean, we need to stand shoulder to shoulder in this and actually show our politicians who are not working and getting paid. We are today are standing on a picket line for no pay. And it's the clear message, get back to your work, because we will stand and we will protest and we will strike until this issue is resolved.